Look at the result, amazing result. I can show you more. This is not whitening. We're actually making white patches darker. See, to see that? The dentists have done, together we do this, we've done 2, took 3 hours, did not work. And that only took 15 minutes in someone's hand. Now the dentists, when they come across MIH, they don't bother with resin infiltration anymore. They go straight with the burr and get this. Amazing. All these are external bleaching, no trace, hands on.
Welcome back to part 2 with Dr. Wyman Chan. This is like an advanced whitening webinar on steroids because these are all the questions that you asked in the community. This is the guy who limited his practice to whitening and advanced whitening techniques. Like, he literally had no handpieces in his clinic. And he's probably done the most whitening in the world, more than any other clinician. So we can really learn a lot from Dr. Wyman Chan. Not only did we ask your questions, but I also showed him my cases and asked him, what do you think about this? I asked him to scrutinize the protocol I used and reflecting on what happens when whitening plateaus. Like, let's say you're doing some whitening, it's going well, but then no more changes are happening. Well, Dr. Wyman Chan had a really good tip for you to try for your patients that seem to plateau. One of the most fascinating things from this interview was about his take on non-vital bleaching. Traditionally, I would do an access cavity and whiten from inside, but he's saying, no, we don't need an access cavity. We can successfully whiten externally for a root-filled tooth. The other themes we covered are white patches during whitening and how unnerving they can be for patients and how to actually manage that and what to expect. We also talk about anterior caries. If someone has anterior caries, is it safe to whiten first, or should you restore, then whiten, and then restore again? And are all gels the same, made in the same factory in China and shipped here and then just branded differently? Is that how it actually works? Or are the formulations actually different? Lastly, we talk about trayless whitening systems. And I don't mean strips, I actually mean paint on gel version, and why there are actually some unique advantages of this way. Now, what Dr. Wyman Chan says that dentists, we don't like trayless whitening systems, but there are a few advantages to consider, and so we reveal all in this episode. For those who stay all the way to the end, you are in for an absolute treat. I know you would have gained so much from this one, so I'll catch you in the outro. Dr. Wyman Chan, welcome back again. You're actually right next to me, so we want to share our screens. As well. Give us a wave, Nikki.
Hi.
Right, so we had that wonderful podcast together talking about all these questions from the Protrusive community, and now right next to me, we get to share our screens. I'll show you my cases, you show me some of your cases, and I'm going to ask you for your advice on some of these cases that have gone well, that have not gone well. So I'm excited for this visual piece. For those of you who haven't heard that previous episode we did, I tell you, it's a Protrusive Wall of Fame. Okay, the energy, because it's very rare. I have my guest next to me, right? And this man, there's nothing he does not know about teeth whitening. So, guys, we covered so much ground on that. Make sure you check it out, including about some very novel technology in whitening, Magic 3. In terms of how it's prophylaxis rather than whitening, actually, ability to remove plaque without even touching it. So it's something, again, we'll touch on at the end of this. I'm sure you've got some cases to show. But let's just dive straight in. Okay, so this is an extreme case, obviously. Very poor oral hygiene, caries, and I had to get in ready, okay? And I did this with some composites, tough work, had to use everything, all the skill set. And then when he comes back some months later for review, like his oral hygiene is obviously improved. His gingival conditions obviously improved a lot, but I wish his oral hygiene was a little bit better. But this was just a placeholder to remind me to talk about something. We see the extensive caries here. I would not feel confident whitening here before the restorative because I worry about the dentine involvement. I worry about the sensitivity. But sometimes you have those smaller class 3 caries, multiple class 3 caries, lesions. How do you feel about pre-restorative teeth whitening in those kind of scenarios where you know that the caries is not too deep? Because some people might say, because the patient has active caries, we cannot give a cosmetic treatment. We have to stabilize the caries first, then whiten, then go back and do the shade management. What do you say?
It depends on the lesions, the extent of the lesions. If they are all contained within enamel carries a lesion. I want a drill. Firstly, I don't have a drill, so I can't drill. And that's why I'm so lucky, because I don't have a drill, so I have to push myself, see what I can remove. Okay, this is the case that will show you This is just into enamel, a very, very shallow Caries lesion. Here interstitially as well. You can see some in the cervical margin on the lower left 4 and 5, and also the upper right as well. You can see that. You see, we're just doing repair. I won't call this bleaching. This is, I like to use word dental wellness and aesthetic technique. So we can bleach all these dark color, which is decay, at the same time, and then remineralize all those areas that are the area that already been demineralized by the bacteria. The patient, why they have this? Because it's 100% is from poor oral hygiene.
So yeah, this case is you're showing us with caries. I can see the caries. Tell us more.
Okay, you can see even palatally, interstitially, you can see there's a caries lesion and palatal on the canine. You can see on the incisal edge as well. And also buccally, you can see all those. They're quite minor lesions here. Here, I would advise do the repair first. I call it dental wellness and aesthetic technology. Do the repair. We just use the bleach to bleach this discoloration away. And then using what our formulation is very special is high alkaline. So it encourages the calcium and phosphate from our saliva to go back to the teeth surfaces very fast. And that's why we have all this remineralization. If self-healing, we have no calcium and phosphate in our products. It's all from saliva. So this is all from your own body. That's why I believe in nature. It's self-healing. Look at it. Look at the result. Amazing result. I can show you more. Let me show you more.
So just to clarify though, so this is for those who are watching this now and they want to do this. You're saying it's not just the whitening, because if we give a tray with, let's say, 6% hydrogen peroxide or 16% carbamide peroxide, we give that, we're not going to get the result that you've shown here.
Using the trays, this is a trays system, we call it a Get to Smile, which we're going to launch this, which we'll call it a relaunch. I've been using this for over 19 years now. We're going to launch this as the dentistry show London, so that if you're using a paint-on system with a retractor, we can paint all the way in, including the gums. You can even touch the gums. This area, you can see all those areas, they be remineralized and been bleached. If you use the trays, especially the design tray, which you score the model, and you cannot get to this area, about 2-3 millimeters of the teeth cervically, you cannot get to it. So that is a problem. That's why in this case, I would use a traceless system so that I can get all the way to the areas that the tray is gonna get to.
I don't know anyone else who's doing trayless teeth whitening. Is this a new thing? I mean, you're obviously doing it for a while, but would you agree that it's not very mainstream, right?
It's not mainstream at all, because I introduced this many years ago. The dentists just hated it because they're so used to trays, they just don't like it. I know a lot of dentists actually told me that I don't think my patients will do this without even ask their patients. So
what does that look like to a patient? Let's say we know what teeth whitening with a tray, what's involved, what protocols you use. Describe the protocol of you're sending someone home with a trayless whitening system. What does that look like? Because we're not used to it. To us, it feels like, how's that going to work? So explain that.
Well, just imagine a retractor. Any retractor. Let's say probably a lot of dentists use the Alkaline. Yeah, the OptiGuard. Yeah, just one of those. You can use one of those and just expose all the teeth that you're going to treat, and just use a brush, the gel, get the gel into your Deben's dish, and just paint it on. So simple. Just like. For the ladies, it's so easy. Just like doing your fingernails. We don't call it a gel. It's a varnish. You only do three brush stroke. 1, 2, 3 on each tooth. It's so simple. Less is more.
Okay. And so, but you mentioned something. Okay. So if someone wanted to try this approach with a proprietary branded 16% carbamide peroxide that you can get in a gel form, and they put an Optigate in and they painted their teeth with the whitening gel, which they would usually use in a tray, would they get the same result?
I have no idea. You could ask the manufacturer. Absolutely no idea, because I didn't make the gel. The gel that I'm using is made by me. The chemistry is for me. So I don't know what it's like.
A carbamide peroxide, or what is it?
No, it's hydrogen peroxide. In this case, I would use hydrogen peroxide. We have carbamide peroxide as well. We can use it, but in this case, I use hydrogen because it's shorter. We do retractor and it's quite tired.
You don't want to give them a long
I want to get it done in 20 minutes, 15, 20 minutes.
You mentioned it's remineralizing as well. So is remineralization a property of hydrogen peroxide?
No, got nothing to do with hydrogen peroxide at all.
So how are we getting the remineralization here?
We just condition the teeth in the, for example, if you make the tooth in the alkaline condition, you will attract the calcium and phosphate from the saliva.
Okay, whereas most whitening systems are acidic, what you're trying to say is that the formulation that you use is peroxide based, but it's alkaline, and therefore it creates the right environment for remineralization. Am I getting the science correct? Or
I do not know whether other gels are acidic. I have no idea because I don't make them. I just know that this the gel that we use is alkaline. I think probably if you remember your preclinical days, I graduated from guys. I think what is very deep in my memory is that Stevens curve. Remember Stevens curve? The critical pH 5.5. The below pH 5.5, you have demineralization of the enamel, and then above 5.5, as you get more alkaline, you have remineralization. This is always a dynamic situation of demineralization and remineralization in the mouth anyway. So it depends on the condition of the mouth and the teeth. That's why if we can get the teeth plaque free and no acid to attack the enamel, and then keep it pH 7, you will get natural. That's why I like to use the phrase self-healing. This is from our own body. We don't need anything else. Our body got a lot of metabolites to repair all these really mild lesions. They can be repaired. You can see that it can be repaired. If you continue using that, all this area will get hard. Just look at that area. Amazing. I'll show you some amazing cases as well. But okay, just want to follow along here, right? So you've done 4 weeks of this treatment, but in a Trayless system, that means 20 minutes a day, 40 minutes a day with your... This is 20 minutes twice a day. Okay, so it's 40 minutes worth of treatment per day for 4 weeks, you said? 4 weeks, yeah. 4 weeks. And this is a very nice whitening result, and it's on remineralization, so that's great. And some lower in the size as well, right? Yes. Okay. And the next step would be for anything that's cavitated to restore the caries. But what if the dentist said to you, or what if the patient said to you, I don't like how patchy my teeth have gone, the white patches. I don't like them. They're round before, and thank you for improving the color, but I don't like the white patch. How would you treat that? And that's why it's so important to have a consent form with the patient. And that's why I always have advocates communication. Really important, and going to manage the patient expectation properly. As a dentist, it doesn't matter what we do. I think really important to manage the patient expectation. If we can manage the patient expectation properly, your success rate is already 80%. If you could not manage your patient expectation, it's going to be a failure on any case, anything we do. So in a consent form, we would have written down that, yes, we're going to make this brown, this dark area whiter. And you can see there already pointed to the patient, can see all those demineralized area. By the time we do it, it's going to get more prominent. So I say not to worry. It's self-healing. What we're doing, we just condition the teeth so that we're going to bring back your calcium and phosphate to remineralize this area. And these white patches will disappear within 3 to 6 months. It's self-healing. We don't have to do anything. Just wait 3 to 6 months. Okay, perfect. And that's very encouraging. But it's reminding me of a scenario where, a lot of dentists on our community, they might have started whitening, and then you get an email saying, I started whitening, I'm 2 days into it, and I'm really scared because my teeth have gone blotchy and white everywhere. Now, I have heard that when that happens, it means that there was a communication issue. We should have warned. Yes. It means enamel damage. Yes. The enamel they have is porous and damaged. Yes. And we need the correct advice there is, don't worry, carry on bleaching, keep on doing the full course. It will correct at the end of the whitening treatment. Would you agree with that? I agree. And also, we also have products actually can make these white patches disappear even very fast. So what we do, we don't just use one product. We use a combination of many products. So it depends on the patient's expectation and also the patient's the requirement. In fact, the patient look quite nice. The teeth are nice and even. Yes, if we explain to the patient that will be the white patches, but but we can reduce that white patches with some other products within 2 weeks. Well, like for example, we can use a Magic 3 to paint on them, because firstly, why do we have white patches here? So we need to understand why these white patches. In fact, the white patches they become opaque. They're opaque enamel. This enamel are damaged. The loss of minerals, mainly calcium and phosphate, and that's why the change of reflective index make it opaque and give it a different tone of the structure of the teeth structure surrounding those non-damage. We look at non-damage, but if you dry them up, because when we're doing whitening, you dry them at the same time as well. So when the teeth are dry, all these white patches become more permanent. So what we can do, we can use a Magic 3, because this is using stronger. This is done in China using 10% hydrogen peroxide. So there's a bleaching effect as well. So I learned a lot. And that's why we brought the Magic 3 in. So we probably one session, 20 minutes with the 10%. Here we use 6%, and one session with the 3%. And then we don't want to bleach the color that much, and that will help to remineralize, to bring the calcium and phosphate back. And when that white patches become the same color of the tooth, that means we have successfully remineralized the enamel. That means that we become translucent. We want to make these white patches more become the normal translucent enamel.
Hey guys, it's Jazz interfering here about Magic 3. Dr. Wyman Chan has given us guys, the Protrusive community, a special discount. Colorless plaque indicator that can really help with white spots, and really excellent for those patients who are nervous about having a scale and they don't like the tools or sonics. A way to really clean and polish their teeth without actually doing much scrubbing, and making that calculus a bit softer and easier to tackle. When I told my hygienist this, she was absolutely in love with the idea, because we have a lot of patients who just prefer hand scaling or minimum intervention as possible, and I don't really like the tools that are used in hygiene. So this minimally invasive way really sounds cool. So if you're interested, head over to protrusive.co.uk/magic3. That's protrusive.co.uk/magic3, and we'll keep updating it as and when Dr. Wyman Chan gives the Protruserati a special discount. Let's enjoy the episode.
Have you got an example of that showing how you made a opaque
I've got
white patch?
I've got a really good case. Let me show it to you.
Yeah, please. So while you're finding that case, I'm just thinking out loud, right? Classically in the UK nowadays, and many other parts of the world, Western world, when we do the whitening and we see the white patch, nowadays we're getting better at consenting the patients that at the end of treatment, we will do icon resin infiltration. In fact, I'll show you a case, so we'll talk about that. But let's go over yours now. Please tell us about this case.
Okay, this case, 16, a young lady at the age of 18 years old. 18, and had started orthodontic treatment. You can see that's why we will show you the lesions were not there before the orthodontic treatment. You see the teeth were nicely aligned, but this on a fixed treatment bracket, because the patient, all these are due to poor oral hygiene. If the patient have very good oral hygiene, this will not happen. But unfortunately, a lot of our patients do not have good oral hygiene. That's why this happened. And then you can see all those are around the brackets. The reason why it's around the brackets, because this area are very difficult to clean. Like look at the bottom teeth are very difficult to clean, which is between the gums and the brackets. So the enamel are damaged, demineralized, and become opaque. Now, what we're going to do, we're going to make this opaque area, the white patches, disappear. Just look, only just 10 days. Look at that. This is not whitening. We're actually making white patches darker. See that? Nothing like this happened before. Actually making the white patches darker, which is amazing.
But this is pretty spectacular in the sense that the opaque white areas, they have remineralized, right?
Yeah, and that's why we bring it back to its original condition, which is translucent. Enamel, if we go back to our student days, our clinical days, they're translucent. So all these enamel are translucent. We see the underlying color of the dentine. That's why we did the same. We just make these damaged enamel and repair them into the normal the status, which is translucent. That's why this disappear. We just see the underlying color.
Do you think this result could be possible with something like tooth mousse?
I don't know. I don't make tooth mousse. You can try. I have no idea. No idea at all.
I don't have any experience with that. I mean, I've seen brochures of some smaller, but nothing this extensive. So if anyone in the community has used that, let us know. So fine. But then a lot of dentists might be saying, I will do some icon resin infiltration. But if you can do something without putting resin then that makes a lot more sense to me, right? Was what you've done is remineralize and not relying on a change in refractive index through the use of resin is more minimal.
Exactly the same scientific principle. It's just changing the refractive index of the enamel. You can do it by self-healing, bring back the calcium and phosphate into the enamel, which is self-healing and non-invasive, or you can use a minimal invasive case, the technique using resin infiltration. It works really well. I'm sure both will work as good, but I think the only thing I'd like to bring it to you.
But G2S, you haven't explained what G2S is though. So this is not the Magic 3.
No, this is a 10%. We just paint it on for painting those area only 15 minutes. Very simple.
But the sort of the UK version, if you like, coming.
All the products works.
Okay.
All my products work on this. Because at that time, in those 2019, China only have the 10%. Now they have Magic 3. They have 2 other products as well. They all work.
Okay, perfect. And we don't need to put any fluoride varnish or anything like that. You just use the patient's saliva.
We don't need fluoride because we're already using our fluoride toothpaste daily. I think there's enough fluoride in the toothpaste. I don't think we need any more. I think just making enamel back to its original grace, I would say. Just make it into normal enamel, which is translucent. This enamel is not normal. It's damaged. There's like opaque in color. It's demineralized.
Now, I'm just thinking out loud. If that patient presented to me, right, and they're like, look, I've just had braces and this is my situation, I'd be thinking, well, the color of your teeth, as per the shade tab, is A3, right? Why don't we let's do some whitening, get everything lifted up, and then hopefully the white patches will blend in, and also close to ortho, maybe some natural remineralization, and then maybe icon resin filtration at the end, if any come. What do you think about that approach of whitening?
It's all depends on the complaint, the main complaints of the patient. The main complaint of the patient here is patchiness. She just want uneven teeth. And now the patient actually, after this, say, now I want my teeth go whiter. I haven't got this is not done by me, done by a PhD in orthodontist, Dr. Oh Yang. And I know that the patients are actually gone for teeth whitening. The teeth must be very white now. So initially, we just sort out the main complaint, which is patchiness. I always believe that when you make the teeth, you make it straight, then you make it beautiful, even, and then the next thing they want is white, straight teeth. I think everybody wants white, straight teeth.
That's it, 2 things they want, straight teeth and white teeth.
Yes.
But do you think if someone does a teeth whitening from here, that could have, we don't know what it would look like straight after. I see the logic here, I get it with a complaint. But interesting, look at that upper left canine. It's got a white patch on the facial, like the white little spot. That was something there that was even there in the pre-treatment before the 2016 photo. If you wanted to treat that, what would be if that was a chief complaint, how would you manage that?
In that case, I would just paint that area with Magic 3, just that area, nothing else. It's 15 minutes, once or twice a day. That's it.
See, I've gone quiet because that is, like for me, I'm thinking, okay, teeth whitening, icon resin filtration, for something that's been there for so long, because what if that white patch is very dense and deep in the enamel? Would Magic 3 still work for that?
It will not work. Magic 3 will not work on see, there are two. Let me go a bit deeper into white spot lesion. There are two, we will classify into 2 types of white spot lesion. One is, we call it Caries lesion. One is non-Caries lesion. Let's talk about a non-Caries lesion. Typically, we see it in fluorosis. It's not, we know that the fluorosis teeth are very difficult to go decay because it's got a lot of fluoride on the teeth. And the second type is called MIH, molar incisor hypomineralization. So these are non-Caries lesion. And they are born and they form when the teeth are forming. So they come out from the mouth, from the bone, from the gums, they're already there. And the other type is caries, white spot lesion, which is this. If you don't treat them, they will progress into caries. This is mild demineralization. So there are 2 different types.
But this canine one is non-caries.
That is non-caries. Right. That's why deeper, the teeth a bit longer. It will go away.
But it will go away. That's interesting.
It will go away. It's not that deep. I can tell from the color it's not that deep.
Oh. Perfect. So here's a case I treated with microabrasion, followed by home teeth whitening system, followed by a little bit more microabrasion in some areas, and then some more whitening. And this is the result we got, I think, about 8 weeks. Obviously, he was over the moon. I won a prize for this as well. this case because the minimal way is managed. But there's still some small brown areas. How does one achieve perfect?
Change the bleach.
Change the bleach. So that brand of bleach has done
has done the maximum already. Yeah, just change on the bleach. Okay. Change to the one that works. I'm sure there's at least one in the market that works.
It's interesting, yeah, because it's a bit like when patients say to us, "I've tried, I'm getting sensitive teeth. I've tried this. Well, okay, change the toothpaste, for example, change the brand of toothpaste." Yes. It's a bit like that. Infiltration case, I'll show you. This was with Icon resin infiltration, but sometimes we want to know, is there something else we could have done to get a good result without having to use resin? Do you know of any ways that we can treat patients like these that I treated with resin infiltration in an even more minimal way?
Yeah, I can show you a case. I mean, finally, I got a very, 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 very good case. This is a typical MIH. Mm-hmm. I can see the color is so opaque. I can see this is very, very deep. That was in 2014 I did this. I told the patient that, what color do you want to go? Can you see the color we get to here? The patients want to go to OM3 from a B3. So I prescribe a treatment that we may have to do some, I would say, targeted microabrasion just here. But I say we have this resin infiltration. I can try it on you. So I did try. It failed. It didn't work that well because it's so deep. So at the end, I didn't drill. I didn't remove and then micro. You can see that some of the enamel is gone as well. So that is quite minimal invasive.
So still microabrasion was done here.
I didn't do my name. In fact, Icon infiltration is microabrasion.
Yes.
You use acid to remove those black area, and that's what it is. And then until you remove all those white area, you cannot see any white area. That means it's all been removed. Mm-hmm. That's why you have to put resin in there to fill it up. So I tried that 11 years ago, because it's so deep, though I know it did not work. When I look at that, it's so opaque and so shiny. It's very deep. So what I've done, I just leave it. I just do a little bit, use a 0.5, as the dentist, use a 0.5 micron, 0.5 burr of a round burr.
0.5 millimeters, yeah?
Yeah, 0.5, and just remove a bit of that. Mm-hmm. And then I put the bonding, and then I give the dentist the bonding to see how do you get such a good color. So we use A1, and then we use XL. We mix them together. When we get the right color, then we bond it.
You mix A1 and what?
XL, extra light.
Fine,
yeah, fine. Until we get until the dentist get the right color, then they bonded it and polish it. Look at how beautiful. I've done, the dentists have done, together we do this, we've done two. It took 3 hours, did not work. And that only took 15 minutes in someone's hand. 15. So in the future, when you see cases like that, don't bother. Just remove a little bit of enamel and just use the bonding. It takes less than half an hour.
So I call this mega abrasion. It's like mega abrasion. So remove the most superficial part of this white patch.
Yeah, we
mask it.
Yeah, we bleach first.
Yeah.
Bleach to OM3 to the color the patient wants, then we mask it. That's it. That's what it is.
And so this is masking with composite. Now, it's a good point you raise that when you use the Icon etch, every cycle removes it.
Removing enamel. Can you see that?
And so what you've done is basically a shortcut version. Instead of using the etch, you're using the diamond.
You're doing exactly the same thing.
Yeah.
Because I want to look at that. The dentist, we work together, show me this. I say, my goodness, why we wasted 3 hours? We could have used a burr and get it straight away in 5 minutes.
Okay, fine.
Can you see that? Can you see that? Can you see the point?
I see the point, and I think it's good to raise the point, because some people do I need to buy something else? Is this the only way? And to remember that our traditional ways, as long as we are careful, minimal magnification, then these ways are possible.
Yeah, this is another way. That's why I found it very useful, and the dentists love it. Mm-hmm. Now the dentists, when they come across MIH, they don't bother with resin infiltration anymore. They go straight with the burr and get this so fast. Half an hour. Just half an hour. That's all it takes. So fast.
So see this lovely lady. When she talks, she mostly shows her lower teeth. You hardly see her upper teeth. And she complaining of yellow teeth. And so her starting shade is A4. And we get to here. That's the same A4 shade. So we went a bit lighter. And eventually we get to around about here. So this is maybe an A2, A1. And she had zero sensitivity throughout. Okay, and she did whitening and kind of stabilized here. Is this the same answer as before? Just change the whitening brand and do some more?
Yeah, just change the brand and do some more, because whatever you're using is saturated already. It will not work anymore.
So I'm about to show you a next case now, which is an interesting one, where I think the patient told me a lie. I think the patient scammed me. And so this part of the video is not going to be on YouTube. It's not going to be in public forum for obvious reasons. This is going to be in our private community. So Angel, make sure that we remove, we pause here and then we'll do the outro, or we just chat a bit more to Dr. Chan. Okay, so this is obviously covered one of the podcast episode we did. We just went into internal bleaching protocols, and there are many, so I'm very excited to hear yours. But this one was a root-filled tooth, so I went inside, access cavity, reopened, and I did place some gel inside, seal the gel, come back, refresh it one time, and then we get this result. And I'm very happy with the result achieved. But interestingly, you said that we don't need to open up the access cavity anymore. So please share your screen. How on earth is that possible?
I must say, yes, that was a very beautiful case. Really nicely done. You should get a prize for that. So this patient came to me, in fact, quite a long time, 15 years ago. Olivia, 18 years old, a young lady, pretty girl, and presented with a single discolored tooth. Then a very, very nice story. And she told me, I asked her, what happened? And then she told me very, very like detail what happened. Remember, in the school days, we have all the children play a game, say what time it is, and then dinner time she bump into the wall, or rush bump into the wall. Remember that when she was 8 years old. But that did not, the tooth did not change color until 2 years earlier when she was 16. So it slowly that diffuse all the way from a dentine to the all the way to dentine, and then enamel is visible. So it's quite interesting that and in that asked the dentist, sent to the dentist, did some pulp test to say yeah, still got some response, and you still can see the canal there. So I know that traditionally that a lot of people would have done a root canal and internal bleaching, because probably they say there's no other way in the old days. But this patient is very greedy. She wants the rest of the teeth whitened as well. So that's why, being a dentist, I offer her all the options that we have. I say we can do veneers, or all of them. We can do porcelain crowns. I say, if you, not me, when you refer to amazing dentists can do wonderful work. If you just want a single tooth, change the color of that single tooth, the upper right one, then we can do internal bleaching, which is the traditional way. And then just show her what internal bleaching all about. We have to open the hole, and then where to root fill, where to do a root filling, and then do bleaching, blah, 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 blah. And then the patient said, no, she doesn't want all that. She came to me because she saw a lot of review, and I can do magical work on teeth. And then, okay, and so we can do it non-invasively. So I prescribed her a treatment, and she came to, because when they come to me, it's not how white to go. How white do you want to go? Mm-hmm. So ask the patient say she likes to go to OM3. So here we go.
Do you charge more? The more white
yes,
you charge
yes. That's why we don't have a price. They come in, they choose a color, then we give them a price, and then we guarantee that they will get that color. So we get that. And this is done in February, and this is only 3 weeks later. That look at that. We don't, and look at I'm lucky. I have a spectrophotometer, so we can see the color from B4 to OM3. All the teeth gone to OM3, and the central has gone to OM2 as well. One of these are central gone to OM2. Mm. So amazing. All these are external bleaching. No trace. Hands on. They get to smile.
This is the
penguin system. And look at that. How beautiful. This new drills
for considering it was calcific metamorphosis, that yellow discoloration. Can this be? I know you're demoing this the dentistry show, but can you think this kind of result can also be achieved with a tray-based system without obviously the access cavity and that kind of stuff?
Yes,
it's a long time, right?
Yes, of course it can. It can. Trays works same as well. We do trays. There's a lot of patients doesn't want to use a paint on the system. One thing, especially ladies. They always talk about they always talk about the wrinkles that make them into the round their mouth that they have, because I tell them that the wrinkle is only temporary. They always go back. Some ladies do not like that. So
Oh, from the retractor? The
retractor, yes.
Okay.
Yeah, so we prescribe trays to these people.
And I think you said relevant to Ian's question from the community was you just whiten them at the same time. You don't like give extra
No, you
useful
don't.
head start to the Discoloured too.
I know there's a many school of thoughts here. There are many articles and many but the teachers. I've been to the lectures as well. They like to whiten the top jaw first. In this case, probably just like to whiten just step tooth to make sure that it works properly, so the patient can see the difference. Because I have so much experience. If you're not experienced, maybe you can whiten just the top teeth first. A lot of people do that so that they can see the contrast. Because if you take good photographs, you can do everything together. Photograph is so important. Please take photographs. If you don't photograph, you end up with a case like Jess, come back and complain, and you'll be in trouble. You have to refund the money. So if you take photograph, the photograph is evidence to show that the teeth have gone whiter. There's nothing the patient can say. So you are whitening them at the same time. The darker teeth will whiten faster. The whiter teeth will whiten slower. At the end, they will catch up. Not to worry, they will catch up.
Okay, and then the black tooth I showed you, the one I treated, could you achieve the result that I did
Yes.
without having to go in the cavity?
Yes, I have many cases. Maybe later I will bring it up. I'll bring it out and show you later.
Yeah, that's really fascinating because the fact that you completely changed my view on internal bleaching, and I think that what's the harm in trying to get some whitening effect, providing of course the usual rules that the root canal is well done, the pathology has been taken care of. Why not do the non-micro bleaching in that way? Would it be a bit slower, you think?
No, this is done in 3 weeks. Really?
No, put it this way: when I've done internal bleaching, within 2 days it goes from black to white because of how quick it does. Would it be that quick if you did external?
No. Because internal bleaching, you're bleaching the dentine.
Yes.
You're bleaching
Directly.
the source of the stain. So with external bleaching, you got to go through the whole layer of enamel.
Yep.
Then get to the dent. It's slower. Internal bleaching, I used to do a lot. Used to do a lot when I was younger, and it's not easy. It's very technique sensitive, and probably you heard other people talk about it. You're going to make sure the GP is sealed properly, and lots of complication as well. So I'm so glad that I don't have to drill anymore. I don't have to go through all these complications, and it's so easy just to use external bleaching. It works well with root tooth as well.
Okay, perfect. I'm looking forward to trying that. Nikki, did you have a question that you found that we haven't covered?
I just was having a look at some of the questions here. There's a very specific one here from Dr. Richard Coates, is it there?
Mhm.
You know that cringe feeling you get with certain things? For me, it's wooden lolly sticks, especially touching my teeth, but touching my mouth at all really makes me squirm. When I whiten my teeth, this gets heightened. I can barely handle A4 paper in my hands. Has he had any other patients complain of this, and did he find a solution?
I never have anyone complain of this. I've done over 20,000 cases. Probably my student done over 30,000 cases. Never 50. I never come across this, but it's not unusual. I have one case 15 years ago. A patient whitened her teeth, result pretty good, but then she came back with a complaint. She said every time when she put her mouth to get teeth together, she hears a click. And not only she's not the first one who said it to me, and other people said it to me. So I checked this, and then obviously the first thing came to the mind is that we said any root fracture. Then I sent it to Martin Kelleher at King's at that time, and then he looked at it, and then he emailed me back 1 minute, not to worry, there's nothing wrong with that. So I think he sorted out the patient. I don't know what happened, but sorted out the patient.
Okay.
So it's
I would like to know, where can we learn more? Because you've got a wealth of knowledge. Where can dentists go to find out more from you?
At the moment, I don't teach in this country. I teach in the Far East. I do run a course. If you're interested, you can contact me. You can find me easily. Just type Dr. Wyman Chan, you can find me. Yeah, if you want to learn more, but I think keep to the simple basis. Unless you want to be a researcher, unless you want to open a teeth whitening center. If you just do like an average dentist, do 1 or 2 cases a month, just stick to what works in your hand. Always concur that what works for you, don't change. Stick to it. Unless you want to go outside your comfort zone and try something else, it may work, it may not work. So it's totally up to you. I think a lot of us, we have so many problems. Why you want to try more new problems and create new problems? Yeah, I always advise stick to something that works for you.
Amazing. John, thank you so much.
You're welcome.
It's been an absolute pleasure. Nikki, thanks for making time. Appreciate it.
Thank you.
Well, there we have it, guys. Thanks so much for watching all the way to the end. Obviously, this wasn't a listen one, this was a watch one. I'm hoping all the cases and the visual element of it was really helpful to you. And thanks to you guys in the community for asking those questions, for being engaged, and for showing up here all the way to the end. You deserve your CPD. Just scroll down below, answer the quiz if you're watching on Protrusive Guidance, and get your CE certificate. We are a PACE-approved education provider. And don't forget, once again, if you're interested in Magic 3s, it's just literally launched in the UK now. Head over to protrusive.co.uk/magic3 for the latest offers. I want to thank Nikki and Dr. Wyman Chan for extending this to all of us. And once again, Protruserati, I'll catch you same time, same place next week. Bye for now.